Last one would be rotation. So if you just move back across the bed a little bit on your back. That's it. So now we want to actually use the bed to support the humerus. So in this position here, the arm can't go anywhere, and we're going to look at our lateral rotation and medial rotation. With all of these, you want their shoulder to feel secure and stabilised, in which case this hand is going to be very important at providing them a sense of security and safety. This is clearly an anterior dislocation position. It is the apprehension test. So therefore, you don't want to be pushing someone's arm into lateral rotation and allowing that head of the humerus to come forwards. So, hand over the top, we apply a small amount of pressure, just enough that they feel secure, don't hurt them. And then holding onto the arm here, just below the wrist, but I have the ability just to stabilise the hand just with my fingers. I can then take the arm round and into lateral rotation. You'll find with your hand there you have less range. So look, if I take this away, it easily goes further. That's absolutely fine, because that's the end of range of glenohumeral lateral rotation, which is exactly what we're trying to treat. Okay, so we're going to come out. Let's just say they have pain here, which is before resistance. We back off, and maybe we could do a grade 1. So just watch the motion, look. Nice and gentle. There's no bounce. Don't feel you've got to chug up against the end of that range. It's fluid. It's relaxing, which is what we're trying to achieve, isn't it? Okay, let's say we go into resistance. Okay, and we get some pain there. We can back off. Let's do a grade 3. Larger motion. But because it's larger, we're not going to ever be quite as accurate. So therefore, nice and gentle. Same thing. Yeah, keeping an eye on the patient, we can see them nice and clearly, asking them how they feel, see how it's progressing. Okay, medial rotation, same concept, we're just going to come onto the other side. This time we're going to be applying the pressure, pushing the arm down and round. And again, if my hand is free, just look at the shoulder, look at it popping up off the bed. Essentially the scapula, the inferior pole of the scapula pushes into the bed and twists the shoulder round. Look, you can see it popping up there. So again, same thing. Nice little bit of stability just in here. You'll find that the range is therefore slightly more limited, so that's fine. So we're coming right up against the end of range just here. That's absolutely fine because it's glenohumeral rotation we're treating, not movements of the scapula. We do that separately. So we come down and round. Let's just say they find some pain there. We're in resistance. Let's do a 4 this time. Back off slightly. And then a nice 4. Keeping an eye on the patient. Shoulder is stabilised. And there we go. Okay, finally we're going to turn them over onto their front. So if you just turn over onto your front for me. Bend your knees. That's it, legs down. Perfect. We can always pop a towel under the tummy if we need to. Okay, I'm going to do the opposite shoulder here. So bearing in mind I was treating that shoulder. If I wanted to keep treating it, I'd have to come round. But for the camera, I'm going to stay on this side. For our medial rotation, we can also then look at performing this with them prone, so that the arm is down by the side. So from this position here, 2 options. First one, someone who's quite muscular, such as we have here. What we might find is that they're quite limited in their motion. So we can perform medial rotation with the arm here. So we're going to take hold of the wrist, take hold of the elbow, and then from that wrist and elbow, we're going to rotate here. Okay? What you'll find, and there's nothing we can really do about it because we don't have the ability to, is the scapula will start to pop up. So there are limitations to this as a treatment. You can probably just about see that on the camera. So we're definitely getting into resistance, but we're not really going to have a decent end of range ability with our technique. Another alternative, depending upon their range, is to put the hand into the lower back, very similar to the lift-off position. And by putting the arm into this position here, we can sometimes therefore get a little bit more of our end of range medial rotation. A couple of tricks to doing it. Again, first of all, we could do a double-handed on here. So one hand on the elbow, one hand on the wrist, and we're looking for rotating that way. And it's kind of a double whammy because I'm pushing down on the elbow as well as lifting up on the forearm. But as you can see, excuse me, the motion is actually coming from, most of it, the scapula now. As an alternative, we can try to hold that down. And the way to do it is we swap our hands, hand comes into here, I'm still on the elbow, still on the wrist, but because this arm is here, I can actually rest my forearm across onto the scapula and then apply the technique. So now I have much more control, and of course we have a lot less range. Okay, finally, turn back over onto your back for me. Finally, we also have lateral rotation in this neutral position. So holding onto the wrist, I like the finger to really point down the forearm. It just gives you that real sense of control, I find, of the forearm. Because as we do the motion, we need to actually keep that elbow in by the side of the body. This hand, again, is quite nice just to have on the front of the shoulder. So then we're here and here. So I'm probably, I'm applying, in terms of, I've got the rotation movement here, but I'm also applying a movement that way. So I'm pushing in the direction of my finger whilst also doing my rotation. So just in here. So let's just go up and see what we can find. There's the end of range. Okay, so let's just say they had just a tiny bit of pain, or maybe this was just a really stiff shoulder. Let's do a grade 4 just off that point. So there we go. If I don't push towards the elbow, as you rotate, their arm abducts, which is no good to us. So you do have to apply that pressure towards the elbow. Okay, that's it for the shoulder glenohumeral passive physiological motions.